Okay. Hello, everybody. Good afternoon. Busy 24 hours. So let's get to this. Unfortunately, the virus has struck our community again. We lost a neighbor in the last 24 hours. She was an African-American woman in her 60s. This brings the total number of neighbors that we've lost this virus to 131. So certainly let's continue to think of her and her family, everybody we've lost in this process, and pray for them. Related to testing, 35,115 tests have been completed at this point. 33,971 tests have been returned. 1,359 returned since yesterday, so a lot of tests came back. We now have 2,024 positive cases, 32 new cases, and 31,947 negative results. We sent 1,395 tests yesterday. We have 1,144 pending tests. Our infection rate now since March is now down to 6%. Again, that's going to continue to drop, hopefully, as we have now gone from symptomatic testing to symptomatic testing with targeted asymptomatic testing. Now we're just doing universal testing. Over the last 3 years on the New York State Department of Health system, the ECLAIR system, we have averaged 1,087 tests returned per day, and our 3-day infection rate is now at 2%. That's going in the right direction. Universal testing at the Syracuse Community Health Center will continue going into next week. Mobile testing. Let's go over the mobile testing opportunities that we have for the community. Again, we are strategically going into neighborhoods to bring testing to you, and we're doing this throughout the county. We're also doing this if we see what may be early trends, not enough to call it a trend, but that's how we're using this. We try to use this surgically and make sure every end of the county gets an opportunity. So today we've been at the Valley Plaza on South Salina Street. So certainly we'll get an idea on how that went later on. Next Monday, June 1, we will be at Clay Central Park on Wetzel Road in our northern towns. So please, 9 to 5, if you want to get a test. You don't need to come downtown to get a test for our northern towns. Next Tuesday, West Genesee High School, so for some of our western towns, again, 9 to 5. Next Thursday, we will be at the Immaculate Conception parking lot in Fayetteville for our eastern towns. And next Friday, we will be at the PSLA Academy, Fowler High School, in the city of Syracuse. So please take advantage of this and get tested. Help put your mind at ease, and certainly if you're symptomatic, you need to get a test. Regional testing, 775 a day, that's our average, that's our mandate. We 1,829 tests from all of our partners. Again, I want to thank all of our partners in our Central New York region for really helping put together the infrastructure in your counties to help us get our numbers where they need to be. Daily average, 1,283 from May 22nd to the 28th. Again, we need 775, good numbers. Looking at hospitalizations, 76, it's down. Out of the 76, there are now 59, that's 59 out of 76, are patients ready to return to their home, which is a nursing home, but have yet to test negative for COVID. So I spoke to the state. We have a couple solutions. We're working with the State Department of Health, but these 59 individuals will not be in our hospitalization numbers very soon. So when you look at the folks in the hospitals now that need the hospital beds, we have made tremendous progress as a community in our fight with this virus. We do have 15 neighbors who are in critical condition. Again, please keep these folks in mind as they are in a fight. and please keep them in your thoughts and prayers going into the weekend. To date, 244 people have been released from our hospitals. So that's very good news, that people go into the hospital and they go home. That's how it's supposed to be. 2024 positive cases, up 32. Again, we received back 1,400 tests, infection rates going down. Out of the 32, 11 are household contacts of previously confirmed cases. So you have a positive case in a house, people live there, they then become symptomatic of COVID-19, enough symptoms, they then get classified as being COVID positive. These folks are not a risk to the community at large. They're already in a quarantine when they essentially become sick with the virus. 10 of our new cases are affiliated with senior living facilities. Remember, we're testing twice a week now, nursing home employees. We're finding asymptomatic employees. So this is what we're seeing. The positive news is this is now not really impacting over the last week the nursing home residents at the rate it was over the last month. And there's a direct correlation with our nursing home and senior assisted living facility residents getting this virus. They then eventually get into the hospital and then move into the ICU. So the fact that these numbers are going down is very, very good for our hospitalization numbers and keeping our residents healthy. And that leaves 11 from community spread. So our community spread numbers right now are 7-day average, strongest week we've had in the fight with the virus since the beginning. So we got to give credit where credit's due. That's to you, the public, for being smart, staying 6 feet away from each other. If you're going to be within 6 feet, wear a mask, and we continue to make progress with this virus. Currently, 843 active cases, 1,055 recoveries, and asymptomatic cases, 48% since we've opened up testing to universal testing, 48% of our cases are asymptomatic. Many of these have been employees in senior facilities, but they're also people just curious going to get a test. And that means that people have had various exposures to COVID. The medical community can't agree on how contagious these folks might be, so we're going to presume that they're very contagious. And again, another reason why you need to be very diligent and protect yourself and your family and be smart. Looking at who our cases have been, 1,202 are female, 822 are male, 93 under 19, 338 in their 20s, 254 in their 30s, 251 in their 40s, 325 in their 50s, 259 in their 60s, 199 in their 70s, 186 in their 80s, and 119 in their 90s. City of Syracuse, 1,130 total cases to date, 541 recoveries. Town of Clay, 160 cases, 107 recoveries. Onondaga, 133 cases, 38 recoveries. Geddes, 106 cases, 30 recoveries. Salina, 87 cases and 57 recoveries. DeWitt, 74 cases and 55 recoveries. Manlius, 72 cases, 55 recoveries. Cicero, 64 cases, 38 recoveries. Camillus, 62 cases, 38 recoveries. Lysander, 37 cases and 28 recoveries. Pompey, 26 cases, 22 recoveries. Van Buren, 27 cases, 9 recoveries. Skaneateles, 15 cases, 15 recoveries. Lafayette, 7 cases, 3 recoveries. Marcellus, 7 cases, 6 recoveries. Elbridge, 5 cases, 2 recoveries. Atisco, 5 cases and 5 recoveries. Spafford, 3 cases and 2 recoveries. And Fabius and Tully both have had 2 cases and 2 recoveries. We just did mobile testing down in the southern towns. Interesting to know, we did about 250. So interesting to see if we get any positives moving forward in some of these numbers. Certainly, restart, we'll take a lot of questions on restart, so I'll just let you ask questions. Graduation, just a reminder to parents, a lot of bad information out there right now. I don't know if that's because our superintendents are passing the buck on your county executive's office or not, but we do not make decisions on what graduation ceremonies look like, or do we give approvals on what they look like. So if you are unhappy with the graduation ceremony choice of your school, which your child is graduating, you need to talk to your principal and your superintendent and your school board. My office does not approve those plans. What we have been asked to do is give guidance in the midst of the COVID-19 pandemic on the safest way to do a graduation ceremony. We gave guidance. That guidance will change as we get into different steps with this, but if our districts are not going to have a open and honest discussion with the parents, we may stop giving guidance. So again, for all the parents calling my office, I did not approve or deny any graduation ceremony plans. That comes from your school district. So please, if you're unhappy with that, reach out to your school district and talk to your superintendents and your principals. Daycare, phase 2, Friday, we're in phase 2. Child Care Solutions, 315-446-1220. Please, Child Care Solutions, great partner of ours. This has been a daycare program that we've had in place since the start of this process. The goal being keep essential workers working. Remember, this started out with our law enforcement partners. It started out with our healthcare workers, nursing home workers. We then have opened it up to all essential business employees when we've had slots available. Why? Because normally your kids are in school during this period of time. So again, there's no income criteria on this program. This is for essential employees, anyone working at this point. And of course, part of this pandemic, and I'm sure we'll talk about this a little bit, is the threat to public health, the economic damage, and the economic reality. Part of the public health that we haven't touched on enough, and right now we see day in and day out, is the mental health of the community. And certainly we've all been tested in this process, so 211 is there for support. Please reach out to 211 if you need to talk to somebody, referrals, your children are having a hard time, please do that. Questions? What are you talking about, Trish? Look, a lot happened since we saw each other, right? And so the best way that I can explain this, and for those of you who haven't followed my own career, I spent a long time being a legislator. And sometimes the legislative process, you don't see the process. A lot of it happens. You talk about the process of making sausage, and usually it's an ugly process. But at the end of the day, you get a tasty result. And that happens at the legislature when you go through that. And what I think we just saw over the last 24 hours was a restart process that played out in the public. So it was confusing. It was at times draining, emotional. But at the end of the day, everybody got the result that was necessary and warranted, and that's that our region got to open up for phase 2 today.
So many county executives last night didn't hold back their frustrations late into the night, specifically Anthony Pezenti in Oneida County. We didn't hear from you verbally last night, but you sent out a statement that was much more tempered. Were you given an idea last night that your requests for phase 2 to actually happen today, did you have a feeling that that was being considered and that the governor's apparent reversal on the radio would again be reversed today?
Nobody's ever had to do this before. So in the heat of the moment, there's a lot of things you can do, and there's a lot of things you can say. I always try to, and I'm not always successful, Andrew. I always try to understand that everybody else who's in these roles that we're in has never had to do this either. And what are the different pressure points? I agree that what happened and the way it happened was not right, and but that did not mean we couldn't still get to the same result. And so Tony Pacenti is an excellent county executive, and I'm very glad that he's my friend. We all deal with these things differently, and what I was trying to do is we still had time to get to the result that was needed. So I took the approach that I'm used to, and we there's been times where I've shared. I always share with you. I'm always very open with you, but there's been times where I've probably aired a little bit too much laundry that I probably shouldn't have, and I took the approach that let's try to get something done, and let's try to understand what's happening. But certainly everything I said yesterday here was true. There was no conversations that would ever suggest that we were not going to be opening today. And so a lot happened at night, but then the reality is we opened up today. So I guess we need to learn from this, and we talked about that because we're all partners on this, and some people like their elected officials more than others, but we don't get to choose each other. The voters pick who's who and what roles, and then it's our job to work together. And when you're fighting a virus, you're all on the same team. We're all on the same team on this. So the hardest work is still ahead of us once we get through this process, and we have to go after a 16% unemployment rate.
But there were some county executives who just didn't think that 9 o'clock, 10 o'clock last night, phase 2 was actually happening today. That became the narrative. But you seem to go to bed with a little more hope based on the statement you released and you pointed very much to the governor's briefing. I'm just wondering if you felt there was something you said in a regional call late last night or were told by a leader on the state level late last night that gave you a little more confidence, like, okay, we're hearing the frustrations. Let's see if we can actually get what you want tomorrow.
Yeah, I think I haven't spoken to the governor. I think the governor made the right call today. And I don't pretend to know his daily process. We haven't had discussions like that. But the right decision was made. And I felt we could still get to an outcome today where the integrity of the process that was set up can still be lived up to. And that's all this is. And this is very, and I mean this 100%, the integrity of this process that was set up when you're talking about restarting an economy is only as good as the citizens having faith in that process. Because if they don't have faith in that process, then they're not going to listen. It's period. And sometimes people get mad at me when I say it's very hard to enforce some of these things. We're under an executive order at 50% staffing levels in government. We're not going to ask our sheriff deputies to put themselves in harm's way over some certain types of enforcement issues. Some of these business enforcement issues, I have 3 or 4 people working on this, right? So if the public doesn't believe in the process, and if the public doesn't have all the information we share every day, that's why we do this. We keep everybody informed. They understand the threat. They understand the progress. They understand where the balance is in central New York, where we need to be. If the public doesn't buy in, very hard to win this fight with the virus. So the integrity of that process survived with this because the data was the data. What happened was a communication breakdown where the governor's team wanted to have a separate set of eyes advise them on the data, and that's where the breakdown in communication was.
How can people have faith in a process when the information is coming out at the 11th hour, as it did?
Yeah, so same thing happened in phase 1. So let's not, we got to do better in phase 3. We talked about that. But essentially, guidance came out very late last night, so technically it came out the day before. Then the rest of the guidance came out today. We need to do better with that. We talked about that. Everybody agrees with that. But what was important was that the data is driving the decisions, nothing else, right? Lots of people from different political persuasions working together against a virus, putting all that aside. Here's a process. That's what has to drive this process. We knew our data was where it is, better than it has been even going into phase 1. So that's why I stood here very comfortably saying, of course we're going to phase 2 on Friday. The rules were set. The data is the data. You can't manipulate it. And we got through that process. So what was different about this is that, again, the public got to see the sausage-making process kind of in real time, where normally many of those things are done behind the scenes.
So what was said last night to make sure this doesn't happen again in 2 weeks right before phase 3?
So our control group had 2 calls. One very long call, and then I spoke to some of the governor's senior advisors very late last night, and then we had 2 calls today, and on a very good call with the governor, with Beth Garvey, who's the chief counsel for the state, heading up this. She went through the guidance with us, answered a lot of our questions. We talked about some of these things we've been advocating for. They assured us they're going to look at those. I think you heard Robert Mojica talk about today in his briefing. We're taking a look at this outdoor seating for restaurants. We get it. We're looking at it. I think that's promising. And I talked about just what we talked about. The integrity of this process is so critical for us to get the public to buy into. And also, every region, we're getting to a point where every region, a one-size-fits-all approach for every region is getting a little bit harder. And very hard to make the argument that Destiny USA is as dangerous to the public health as Walmart. You can't make that argument. And so Destiny USA, very easy physical distance, right? I have many small businesses in Destiny USA, so I'm very concerned about this, and I'm pushing for them to be treated the same as other retail. If you're going to have retail open, we need all retail open. So we're having those conversations. But there's things that are specific to our region that are different from other regions. There's the data, but there's also, each region has a different point based off of the data with that balance that we have to find. And right now, in our COVID-19 public health, there's the virus, the impact of the virus physically on people, but the mental health of the community is a very serious issue right now. We're looking at suicide rates. We're seeing opioid overdoses on the rise. I don't believe it's a coincidence that this is all happening in a pandemic, and I don't believe it's a coincidence that it may have to do with the loss of some of the liberties for a period of time as well. So we have to find that balance and balance that out with our economic balance. So when the data says go, it's a big deal for the community to go. It is. Getting a haircut. Everybody's going to get a haircut in the next 48 hours. I know everybody will. You're all going to look great. For people not to be able to get a haircut, Ryan McMahon had an 8:30 a.m. haircut appointment today. And I didn't get a haircut. So that had a mental health impact on me. So these are small things that mean a lot when you've had this taken away for 60 to 90 days.
Who canceled the haircut, you or the barber?
I canceled the haircut. I'm not even going to ask what the barber did. They get a 4-hour pardon if they were open.
So going back to this regional idea, you're saying that different regions have different places that they're at. The big confusion seemed to be who has the final say in whether we open phase 2. Is it the regional control group or is it the state? And yesterday you were saying we're looking at the data and we feel like we have the okay to start. And then today it was you've got to wait until the governor gets up and says we have the okay. So going forward, is the regional control group going to have any actual authority to move on to phase 3, or will this be solely controlled by the governor?
So, Chris, what I heard the governor say, and I listened closely, and I hope to talk to him. I listened closely to his language today. I heard the governor say the data was the data. I had some consultants look at the data, and then because the data was where it was, restart started. So I don't think we were too far, our positions were too far off each other yesterday. What we didn't understand as leaders, we didn't know that there was going to be the concept of having different advisors to the governor looking at this as part of the process was not something we had an understanding on. And we know about that now, so that shouldn't be. We'll be pushing. Has Dr. X and Dr. Y looked at the data? They see the same thing we're seeing. we'll be pushing that earlier going into phase 3 now in our control room process. But that was the missing link. That's like me having a conversation with Dr. Gupta and Dr. Thomas, an epidemiologist from upstate. How do you think we're doing? Things are going well? Okay. I don't broadcast that as part of my process, but that's part of a process I have.
I guess, but so at 8 o'clock last night or 7 o'clock last night, the state representatives were saying we're not ready to reopen. So was the data analyzed between then and 1 o'clock today?
I was
to get
told
the
at
okay?
midnight last night, and our data was being analyzed at that time. Yeah.
So in 2 weeks, if everything goes as planned, at 12:01 on Friday, we'll be able to start phase 3, or are we going to wait till 1 p.m. for the governor to announce Central New York region can go?
We'll try to find a compromise on this. We're going to try to have the governor the day before talking about phase 3 at 12:01 the next day. How about that? That way you find a compromise on it. I think the data is going to drive the decisions, and we'll all learn from the last 24 hours. We'll all learn from it.
Some people feel misled. Do you feel misled?
We did not know certain things, and I think certain things were, certain part of the state's internal process was kind of, whether it was taken out of context or not, it kind of looked like a new set of criteria, which would have meant the goalposts were being moved. That's what it looked like at 7 o'clock. At midnight, after I talked to Jim Alatras, I had a better understanding of what their internal process was.
Could you give us a little insight? Is it just that overnight between phases we'll show it to these 2 international doctors?
Yeah, I think, look, I think for us, and again, I explain the Central New York perspective to the state. It's important they hear it. But it's important we try to look through their eyes a little bit too. They've been overseeing a response in New York City, Long Island. We can't even imagine what has happened down there because we haven't seen it here. From our perspective, we look at it, hey, you haven't had to come here because we've been doing okay. We teamed up. We brought all the partners together. We've been working as a team. We actually view this as that because we had our act together, we made your job easier, and you could go focus in on those hot spots because we never had one here. So you bring those perspectives together, and because the state hasn't had to be here the same way they've had to be in other regions, they're starting to recognize many of the things that maybe they thought we weren't doing, we've been doing the whole time. They're starting to understand what our game plan was. They're getting more comfortable that our numbers aren't just our numbers because we're in the middle of the state, but because of a lot of the things that everybody's been doing in our health department, in our hospitals, and the community at large. So this has hopefully been a fruitful exercise where we can work better moving into phase 3 and phase 4. And then after that, the real work starts. We have to really look at working together on policy that's going to drive an economic recovery, at the same time preparing for a potential second wave of this thing in the late fall. So there's a lot of work to do, and we have to do it together.
You've given the governor the benefit of the doubt today, it seems. Other leaders hadn't overnight. Do you feel that trust in him is eroding?
I'm not going to answer that, Andrew. I'm not going to Monday morning quarterback any of my colleagues in this process. So the end of the process, people will judge the governor, the president, myself, and others on the decisions we've made. I've always said our team will pivot when necessary. I think the state pivoted, and we got the outcome we needed.
Some of the guidance that came out from the state conflicts with some previous decisions made locally. One example is zoos. You gave permission for the zoo to open last week, and then the state's guidance today said zoos can't open. What do you do in that case?
Yeah, Onondaga County government is a government. The zoo is not a private entity. The zoo is a park, which is part of our government. Another government can't tell us to shut down our government, right? So that's the way we feel about the zoo. I know some of the zoos that have complained to the state leaders that we're operating, how are we operating? Because it's a county park, and we're a government, and the government's not going to shut down. I got elected. There's a charter. I have a job to do. And so no other government, federal or state government, is going to tell the local government you have to shut down. I swore an oath. So the private zoos, I read that as that the private zoos that are either a public, private, or a private are not operating. That's how I read it.
What about Destiny? Malls were also included as something that can't open.
Yeah, I told the state I don't agree with the premise. I think it's unique. The state is looking at it. They're looking at it. So there's a concern from the state that the malls in other states haven't opened yet. So I think they're looking at it from a bigger downstate, Connecticut, New Jersey perspective. From a health perspective, local health especially, I asked them, I need someone on their policy committee to come up, and I'll walk them through the mall. You can see how easy and how safe it is compared to other retail that's open. So I think you're given an unfair playing advantage with the mall not being open yet to other retail. And again, a lot of these aren't box stores. A lot of these are mom and pop shops that are inside the mall. So I think we got to, again, be flexible. Hopefully some of these other states move on malls, and that will make it easier for New York.
The zoo was just mentioned. Are there any other entities the county is running that go against state guidance?
What was that?
Is there any other things like the zoo that the county is running that go against what the state guidance is?
I don't know. Is somebody trying to tell us we need to shut down our wastewater plants? There's certain things we're just not going to do. If another government tells me you have to shut down a department, the answer is no all day long. That's not something that can be done. So I don't believe there's any conflicts. I don't believe that's a conflict. I think there's states talking about zoos that are privately run and that aren't a county park.
You sounded confident earlier this week that Destiny USA was going to open. Were there calls that kind of led you to believe that, or conversations that led you to believe that?
It's a retail, these are retail companies that are in, a mall. There's strip malls and there's other types of malls. So there was nothing in any of the guidance about phase 2, this whole process, that anyone would presume that Destiny wouldn't be open. But now the state has an order right now. Let's work through this, help them understand it, so we can get them open and we can get these people to work.
Do you think there's a disconnect between the state leaders you're having conversations with on regional calls and the people making the decisions, the governor's office?
I don't know. I don't think a disconnect's a fair word. I think you have the governor of the state. I just look at it through my job. We're, essentially we have the same departments. We're a CEO. He's a CEO of how many people? 19 million. He's got a financial mess. I got a financial mess. I don't know how information flows or how often it flows.
But if Matt Driscoll and Colleen Deacon never told you phase 2 can't go Friday, the mall is fair game, even if they didn't stop you, they clearly didn't know that and weren't told that by the governor's office yet.
You'll have to ask Matt or Colleen what they were told or not told. I'm not going to speculate on that.
One of the things we're hearing now is we went through this and we got guidance at the very last minute, and some businesses that thought they might reopen in phase 2 now aren't reopening. So we've got phase 3 and 4 still coming up, and some people are saying, why don't we write this guidance today so that we can prepare for the next 2 weeks and 4 weeks? Do you have any idea when? I mean, just from these regional control group meetings, are you getting an idea that we're working on phase 3 guidance now so that you'll know a week in advance versus 4 hours in advance?
Yeah, that was discussed today, and they recognize this has to be smoother. And certainly we talked about certain industries that are in these hybrid situations and asking them to look at that and give guidance even if a piece of their business can operate earlier. And I think there's a chance for, some of these things that are hybrid to happen before a phase 3 or a phase 4. I think those are discussions that are being had, and we're not being told no. So I think that's progress.
Are you putting any sort of deadline? Can you put any sort of deadline on we want phase 3 guidance at least 5 days before?
It would be, I don't know that we can put a deadline, but everybody acknowledges that getting this guidance out as soon as possible is the best thing to do. Everybody agrees on that. So I thought that was promising.
Phase 2, though, was worse than Phase 1 in terms of the rollout. What gives you confidence that Phase 3 will be better?
I think the conversations of the past 24 hours and the actions of the past 24 hours, I think, were important. And we always thought we could get to the same outcome. And that meant people had to pivot a little bit on some of the perceived positions that they took. And everybody involved did that to get to the outcome necessary. So I think that's hopeful.
Were any businesses cited or fined or anything this morning?
No. 4-hour pardon for all the businesses.
What do you say to those business owners that thought they could open this morning and then they had to wait until Governor Cuomo went on TV at 1 o'clock and said, you can be open?
They're open. It's Friday. Let's try to move forward. A lot of bad things could have happened if this thing didn't stay on track. The integrity of this process was in jeopardy, and everybody made the right moves, and we're on track. So I think I'm going to let all of you Monday morning quarterback all the stuff that happened. I'm not going to Monday morning quarterback.
You said that you'd like to talk to the governor. What would be the first thing you would say or question you would ask him?
I don't know. I just I'd like to talk to him a little, just laugh a little bit. I think it's been a remarkable, and again, look at he probably deals with this all the time. You know, you think about how many local elected officials he probably works with, but certainly this was high stakes for this community. This community, mental health right now is as big of a public health challenge in this community as the actual infection spread, and those are two serious challenges. So how do you deal with that for people when you work hard and you get progress? You get to see and feel the fruits of that labor. And so getting this done today was important, not tomorrow, not Sunday or Monday. Today was really important for this community.
When did you learn the governor was going to give us the green light? Was it watching with the rest of us, or did you get a heads
I knew
up?
Chris, I knew it would be a matter of hours, whether it was today or tomorrow. I knew today. I just had the sense that the governor was going to make an announcement. I knew that, and I just had the sense that it was going in the right direction. You would get a feeling with your communication if it was going in the wrong direction.
This goes back to my original question, though. You must have said something on a late-night phone call last night that another county executive didn't, that had these state leaders say, we got to make this happen tomorrow.
I said lots of things, Andrew. There's a lot of things said over the last 24 hours. So, again, those are privileged conversations, and you know, the result is the result. And we're in phase 2.
Other politicians would take a lot more credit.
I'm okay with that.
So we're in phase 2. What does that do for the amount of people out in public? What should people be aware of as they go into retail stores, hair salons? And I'm wondering financially how that can start to improve the picture locally.
Yeah, if you think about it, you're going to have more density in your downtowns. That means some of these businesses doing takeout restaurants are going to probably beef up their team a little bit, bring some people back to work, hire some people. That's going to create opportunities for more economic activity, sales tax. You know, you get people back to work, they feel better. Some people maybe be on the sidelines not getting paid. Now they're getting paid. So what this was about and why today was so important was for the small business person who is a sole proprietor. They don't qualify for PPP loans, and they don't qualify for unemployment, and missing out on a day's wages means they might not have money for groceries over the weekend. I've said this before, but there's two types of calls in my office. Someone screaming and yelling, and someone crying because they're desperate. So over the last 24 hours, this has all been about them, making sure that today, whether you're at a hair salon or a barber, one of these small businesses, that you got to get out and have a chance to earn a wage and improve your life for yourself and your family. So that's what it's been about over the last 24 hours. A little ugly how we got there, but we got there.
You mentioned you had to cancel your haircut this morning, and I was kind of wondering, did you have to have the conversation with them where they asked you what's going on? What did you tell them?
So I did not talk directly to them. I was ready to Venmo them the money in the event things went south anyways to help them get through. But I wasn't going to go there. I didn't know enough about where everything stood. To me, the data drove the process. The data drives the phases. And if people had opened up based off of this briefing yesterday and they didn't pay attention overnight, they're busy. A lot of people didn't pay attention to everything. And they opened up, nobody should have held that against them. And so I was less concerned about whether they were operating and what they were saying. I was more concerned about trying to figure out what the plan is moving forward than what was happening on the ground for a period of time.
You mentioned the sales tax payment. Did you get one this week?
I don't believe so. I think we have a couple. I think we have 3 in the month of June. Fiscally, June's the big month for us. We are going to know later today how many people took our retirement incentive. That will give us a perspective on what kind of end-of-the-year savings we can get there. We will know after 3 months of sales tax, really showing the pay periods where we were shut down and then where we kind of phased up a little bit. That will give us a sense of how terrible it is and where we think we can climb from there. And then if we don't get federal help, we're going to have a real problem. And certainly if the state then cuts us, we're going to have a real problem. So we're going to learn a lot about our fiscal house. It's a 2020 fiscal challenge. It's probably going to be okay in 21 and 22, or at least it will be manageable. But we need the federal government to act on a stimulus package for local and state governments, and we need the state of New York to, hold local governments harmless.
The other thing that's on this website about phase 2, it says dine-in and on-premise restaurant or bar service is closed, which on-premise to me sounds like if you sit on their property. Did you?
Keyword, service.
Yeah, it says off-premise consumption.
Yeah, you can't
Excluding
consume
takeout or
alcohol.
delivery for off-premise consumption.
Yeah. Consumption's a drink, right? Trish, you never had a drink before, I'm sure. So I haven't seen the verbiage. I'm not too concerned about the verbiage. I think all that will be a moot point in a week or so.
Are you going to release an executive order helping businesses here with clarity?
On that, no. About the picnic table situation, picnic
Yes.
table gate, we will address picnic table gate for all of our restaurants. And the State Liquor Authority has made it very clear you are not to have any alcohol or any service at the picnic tables that may be on your property.
Any update on churches heading into the weekend?
I think we have not seen guidance from the state. I think the churches need to certainly look at the guidance they've received from the different governments and decide what they want to do. And
I think, you said earlier this week you're going to make a game day call.
Yeah, and my game day call is, Chris, I'm going to leave it in their judgment. Certainly, I've talked to many different religious institutions, and having large gatherings where you can't physically distance is not the smart thing for their congregations, and I think everybody understands that. I'm not going to give guidance against either the federal government or the state government on this. They're two separate guidances. I think I've proposed something that if the state it's easier to talk to the state than the federal government as far as making policies. So if the state moves in that direction, which I hear they're talking about, I would be very happy to endorse that. But at this point, I'm not going to get involved with the federal government or state government. I'm not going to pick sides on that. But I do implore certainly all of our religious institutions to everything's got to be physical distancing. Everything's got to be masks. We've had cases from churches. That's happened. And to keep your congregation safe, you got to be smart. And that means you can't have, if you fit 200 people, you can't have all those people in there. So we need everybody to be smart. And but certainly I'm not going to, we're not going to be enforcing prayer this weekend.
So to clarify, it's up to each venue, pastor,
they got to make
priest,
they got to
rabbi?
make their choice, right? I'm not going to give guidance and say which government's guidance they should listen to.
Does the number of people in a gathering go up now that we're in phase 2, or is it still 10 people to a gathering?
Still 10. I think that's something that the state will probably be looking at, but right now it's still 10.
How would you describe that call that you had last night at 7 o'clock?
Very spirited. It was a spirited phone call. If you met my good friends Chairman Becker and Chairman Hyder,
He called it rowdy.
Chairman
Becker.
Chairman Becker called it rowdy. He's rowdy. So I thought Chairman Becker, and I hope he's watching, I was under the impression he drinks a lot of coffee or Mountain Dew, and he told me he doesn't drink either. And so he's a spirited individual. I love Chairman Becker and Chairman Hyder and Chairman Weatherup, and certainly Chairwoman McNabb Coleman, great partners, and Mayor Walsh has been a great partner. So we got a spirited group in Central New York who are very passionate about their citizens, and we're closest to all this. So when you're looking for intel on the ground from a larger government, you come to us and we can give you the intel. And the public health is bigger now than just COVID-19, the virus. This virus has had other impacts on the public health. And how do you address those? We gotta move when it's safe. When we can do it in a safe way, and Dr. Gupta and her team feel that it can get done, we gotta move. We gotta pivot. That doesn't mean you rush, but it means you gotta move.
You joked about the haircut being called off as a mental health hit for you. You signed up for this. You were appointed, then elected. But what is your mental health status right now? After a call like that, after a whirlwind 24 hours like that, going into a weekend with a family, you're still a father? Yeah,
at the end of the day, on Monday, I wanted phase 2 to start on Friday, and it started on Friday. So that's exactly where we wanted to be at the end of the week. I'm going to try to get back in and get a haircut, nice high and tight. You guys can check it out on Monday because we're going to take the weekend off. But I think overall, outside of a 24-hour period, it was less than 24 hours really, but over that period, we got where we needed to be, and now we still need to get further. And we got to grow together on this because the work is not done once we get through this. That 16% unemployment was at 3.7 months ago. So we got to get people back to work, and we got to look at ways to innovate and look at policy at the state level and local level that will really encourage people to invest here and encourage manufacturers to look to repatriate manufacturing from overseas here. And we think, there's for a lot of reasons we could be a home to some of that. Anything else? Homework assignment, you know what it is. You all looked a lot better 70, 80 days ago in our media. You all need to get haircuts on Monday. That's your assignment. Andrew, haircut, okay?
I couldn't
Chris,
get in until June 6th.
You look pretty good, Chris. I think you still need a haircut, though. So let's get that done. Everybody, please enjoy the weekend.
Don't expect Monday, June 6th. I'm scheduled.
It's June. Oh, geez. Well, thanks, everybody.